DiCarlo. I'm a hematologist and medical oncologist, and I've been practicing in the Central Coast area for about 20 years after moving here from New York. Currently work as the medical director of UCLA Health's Oncology clinic here in San Luis Obispo, and we've been open for about 5 years here. I was introduced to SabesWings a few years ago after one of my patients was able to get some help with out-of-pocket costs for their cancer care. And I learned a little bit more about it in the coming few months, and talked to Candace and went to their event, and it's one of those situations where our patients are being faced with these obstacles and these roadblocks of getting the proper therapy for their cancer care, and any foundation or group that is there wants to help with the financial burden of cancer care, which is really increasing over the last few years, is really welcome in this community. As we're moving forward, I'm hoping to work more with SabesWings and hook up with UCLA and the resources that UCLA has as an entity, and work with SabesWings to help patients. I was introduced to SabesWings a few years ago after one of my patients was able to get some help with out-of-pocket costs for their cancer care. And I learned a little bit more about it in the coming few months, and talked to Candace and went to their event, and it's one of those situations where our patients are being faced with these obstacles and these roadblocks of getting the proper therapy for their cancer care, and any foundation or group that is there wants to help with the financial burden of cancer care, which is really increasing over the last few years, is really welcome in this community. As we're moving forward, I'm hoping to work more with SabesWings and hook up with UCLA and the resources that UCLA has as an entity, and work with SabesWings to help patients. It's very prevalent, more prevalent than many of us know, and as doctors we don't necessarily see it as much as you would, as much as it's actually happening. But what I would say is it's very frequent. To give you an example, there's not a week that goes by that I'm not doing a peer-to-peer call with an insurance company to try to get a test approved, or get a drug approved, or to advocate on my patient's behalf to get their costs covered. And those peer-to-peer calls don't always lead to positive outcomes, and sometimes we need to go to other avenues and other programs that can help our patients cover care. As far as cancer medicine, the treatments, the advances have never been better. It's really the golden age of cancer care, where the advancements in treatment of the disease are really increasing on an exponential rate, but so are the costs. The costs continue to go up for these medications, such as immunotherapy, these targeted medications, and the insurance companies are kind of pushing back and putting more costs on patients, more out-of-pocket co-insurance, co-pays. And we routinely, my staff, we have an entire team dedicated to finding benefits and help for patients to cover their costs. The American Society of Clinical Oncology, ASCO, recently put out a kind of a position statement saying that talking about finances and financial toxicity needs to be part of the initial oncology consultation. That's how important it is. And the treatments, while they are more and more effective, are so expensive that even if you only have a 10% copay, that can be completely debilitating financially. So patients bring it up in their initial consult, but usually it's later, right? Because in the initial consultation, you're talking so much about the disease, they're digesting a new cancer diagnosis and everything that comes with it. But as time goes on, they say, how am I going to afford this? one of my routine lines is when I talk to patients, especially about oral oncology drugs, which can cost upwards of $15,000 to $20,000 a month. What I tell them is when the pharmacy calls you, they're going to initially say you owe us $4,000 a month, and I tell them not to panic, not to freak out. Our next step is to go to foundations like SabesWings and other foundations that are out there to help with that, and we generally can get the costs down to something manageable, $25, $50 a month or something like that. But it takes a lot of work and a lot of help from foundations. I can tell you a patient yesterday, actually. I just saw a lady who has metastatic breast cancer, and she has been doing well on these oral therapies that are very expensive, but unfortunately her disease has become resistant after a couple of years, so we had to switch her to a new medication. This is a really promising medication, just got approved by the FDA a few months ago, and I was excited to be able to offer that to her, but the first thing she asked was, what's it going to cost? Because last time I had to fight with the insurance company. I had to figure out how to get copay assistance. And as we were speaking, my medical assistant came into the room and said, "Hey, we just got a foundation approval for copay assistance. You're going to be able to get the drug for free, essentially, fully covered." And you could just see the stress and the relief sort of on her face, or the weight off her shoulders, however you want to say it. And now we can focus on her cancer care, right? So that's the impact. In the United States, it's a complicated process, right? So when a patient is diagnosed with cancer, the first thing I'm thinking about is what's their treatment plan? What does that look like? Is it chemotherapy? Is it immunotherapy? Is it these targeted therapies? What is surgery, radiation? All those things play a role. When I order a treatment plan, we put the orders in, and then it goes to a team, and we have UCLA actually gives us a team of authorization professionals, and their sole job is to get insurance authorization for these expensive treatments. And so that has to go through that. Sometimes treatment is delayed while we're waiting for that. And the length of time that has taken to get prior authorizations has increased every year. So then when we get insurance authorization, then the next step is, well, are they going to cover some of it? Are they going to cover 80%, 90%, 100%? If a patient has to pay 10% of a drug that costs $10,000 a dose, it's a lot of money. So then the next step is to look for financial relief. And what SabesWings does, and other foundations like it, is fill in those gaps, right? Because insurers are really pushing more costs onto patients. So there is this very important gap. So that comes back to the patient, and they talk to a financial counselor who lays out what the costs are looking like for them. And some of us as physicians don't even know what that really looks like until 6 months down the road, and a patient comes to us with their bill, and is obviously very upset or stressed out, and then we have to kind of go back, and Candace was talking earlier about their group going back and fighting for patients to try to get things covered that were already received. So it can even happen 6 months, 12 months, 18 months down the line.